Before I was engaged in whole health, I was in a really dark place. I wanted to end my life. My physical being was wearing me out. I've had a lot of surgeries. I wasn't able to walk on my own anymore. And I really didn't want to be here. I didn't want to be here. And I got lucky. I came here. I seen Dr. Forbes, who, after my second visit, asked me if I would be willing to listen about a new program, Whole Health.
Mr. Martino was given to me as a handoff from his primary care doc, who thought that he seemed depressed. He reported to me, first time I met him, reported to me he'd struggled with depression for many years. Had a lot of physical problems, a lot of mobility problems, and was kind of defeated, really kind of down and just about to give up. Kelly Johnson had explained the mission of Whole Health to me, and I thought maybe this is something he can benefit from, because this is a long-term issue. Maybe some coping skills, some mindfulness, meditation, those kind of things would be of benefit to him. I suggested it to him. He was reluctant. A lot of my patients are, because it seems kind of fluffy, it seems kind of hippy-dippy, but he agreed to try. So that was step one. And once he met Kelly, then she really connected with him well, and it's been a great benefit to him.
Kelly Johnson called me and asked me to come in and for an appointment, and I came in. And I came in totally with the attitude of, why am I here? I'm not going to do this thing, you know?
Sam Martino was one of my first patients in Whole Health. He was referred to me by Dr. Forbes, our clinical psychologist here at the clinic. And she had him in her office, and she asked if I could see him. So I brought him over that same day. When I first met him, he seemed very depressed. I went through my whole talk about Whole Health, what it can do for you.
After listening to Kelly for an hour, she simply said, would you like to come back next week and try the program? If not, you don't have to. So it wasn't anything I was forced to do. And I did like her presentation, so I did come back the next week, and it's probably changed my life. Well, a session with Kelly is about me. The Whole Health program, there's different things about me I could work on. I could work on my mental health, I could work on my body, I could work on my family. There's a number of things, and it's a circle, and in the middle of the circle, it's me. I get to pick what I want to work on. My wife, for many years, has been asking me to seek help. I've been going through the depression for a lot of years. We've been married 38 years, and she's seen every side of me. I could get depressed on a dime, and she would notice it. And she'd ask me, what's wrong? I'd say, I don't know. Why won't you get some help? Maybe medication to help you. And I'd say, I'm not going. I'm not going to do that. I don't want to, I don't want to share my inner things with people. And she, over the years, she's seen the anger, she's seen the depression, the solitude, not wanting to be around anybody. And she'd say to me, you don't want to go anywhere. You don't want to do anything. You don't want to see anybody. You don't even call your friends anymore. She's seen me isolating myself, and she talked to me about it. And after the Whole Health program, after I started the Whole Health program, it's like, wow.
I've become friends as well as his coach. I feel like he has done this. I didn't do this. I just encouraged him to do this. He feels like I have done it. And I tell him all the time, no, you did this. You are working on your goals. You are doing this. He always tells me, you need to take some credit. But I really feel like it's amazing to have a job that I can support veterans in reaching their goals. I get just as much joy out of it as they do.
I can't be thankful enough for this program. I could talk for hours and hours about Whole Health program, about the coaches, and about everybody involved. It's the greatest thing I think I've ever done for myself. And I really do find Whole Health to be a lifesaver, for me anyway.
So Sam's story is one of thousands of similar stories that we've been hearing, and it really is transformative. So for Sam, it is getting above the medical conditions that he's got, as well as the mental condition that he had. And because of Whole Health, he was able to transcend the difficulties of those conditions and be able to change his life. Visinate Whole Health implementation is unique because of two things. One is we're integrating it with primary care and mental health, so then it is delivered as an integrated approach. So then Whole Health, primary care, and mental health is delivered as one approach. And then the other thing too that is unique is that it is a massive rollout. So we are rolling it out across all 7 facilities. Our staff who have been exposed to it, to our Whole Health program, they really like it because it has changed their lives. It has changed their relationships within their family, and it has changed the way they even look at what is important to them.
My emotional state after, from being in the Whole Health program at the beginning to now, is just a world of difference. I'm a different person. I'm not the same person that started in this program, and I thank God for that. I really do, and I thank God for everybody in this program. Whole Health is just a lifesaver, and I wish everybody would try it.